If your trainer's walking behind you like this and not actually looking at the position of your knees and your hips, allowing them to cave in this severely, you gotta find a new trainer. Welcome back, everyone. I'm Dr. Brian Sutterer, and this is your #1 source for everything related to sports injuries and sports medicine news. In this exciting new series, I'm gonna take a look back at some of the biggest names in the NBA to have their careers tragically cut short due to injuries. We'll look at what happened throughout their career and if there was anything that could have been done, especially in the modern age, to save their careers and allow them to be the best they could. Make sure you're subscribed to stay up to date with the rest of these videos, and also go check out my Twitter page for real-time injury breakdowns and analysis. And let's get started with our first video, looking at none other than Brandon Roy. Brandon Roy tops a lot of what-if lists when it comes to players whose careers were tragically cut short due to injury. Roy was the NBA Rookie of the Year in his inaugural season, and players around the league praised his skills and abilities. When asked in 2010 who the hardest player was in the league for him to guard, Kobe Bryant said, quote, "Roy, 365 days, 7 days a week. Roy has no weakness in his game." But unfortunately, the downfall of Roy's career was well on its way before he even stepped foot on an NBA court. As we know, Roy suffered knee problems going all the way back to his high school seasons and ultimately had to retire after the 2010-2011 season with essentially no cartilage or meniscus left in his knees. The story of what happened to Brandon Roy's knees really begins with the role of the meniscus. Before we dive into that though, I want to give a quick shout out to the sponsor of our video. Today's video is sponsored by ExpressVPN. Internet security and privacy are extremely important to me with as much time as I spend on the internet, and that makes having a top-notch good quality VPN service an absolute must. ExpressVPN is the market-leading VPN service and overall #1 rated VPN by TechRadar. Without a VPN service, your internet browsing activity can be tracked by your service provider, by ad companies, even by hackers. But by turning on ExpressVPN with just one easy click on any of your devices, you're gonna get that security and protection that you need to feel safe on the internet. I'm using it even when I'm at home because your internet service provider can see every single website you visit. It doesn't matter if you use incognito mode or clear your browsing history, and in the US, they're legally allowed to sell that data to advertisers. ExpressVPN blocks out my ISP from seeing what sites I'm visiting and collecting my data. Find out how to get 3 months of ExpressVPN for free by clicking on the link below or heading to expressvpn.com/BrianMD. So thank you again to ExpressVPN for sponsoring the video, and let's get back to our learning. It's been reported that Roy had somewhere around 6 to 7 surgeries on his knees, starting all the way back in high school. If we look at what all these surgeries were, there's one theme in common. The majority of them all seem to involve the meniscus in both of his knees. The meniscus is a piece of cartilage-type soft tissue that sits in between the tibia and the femur within the knee. Throughout most of the 1900s, doctors thought of the meniscus as a vestigial structure, meaning really it had no function or purpose within the body. As recent as the 1970s, there was some thought that removing the entire meniscus would result in no additional harm to the person's body. But thankfully, we've since learned that the meniscus has very important roles in the overall function of the knee. Particularly, the meniscus helps to distribute load and provide some shock absorption through the knee joint. The shape of the meniscus allows it to sort of conform around the bones in the knee joint to help decrease the stress that's imparted from the tibia onto the femur. Physics tells us that stress is equal to the force divided by the area that force is applied through. So if you take the force of an entire basketball player's body weight and apply it just to the small little contact force where those bones would touch, the stress is going to be extremely high. But the meniscus increases that area in the denominator of this equation, which allows the stress to decrease. Now, the majority of reporting on Brandon Roy's knee surgeries talk about repair to his meniscus after some sort of tear. It's important to understand there's a difference between repairing a meniscus and cutting out a piece of the meniscus, which is something called a meniscectomy. Whenever someone has a meniscus tear, ideally we want to preserve as much of that tissue as possible because of what I just talked about with lowering that stress in the knee. But unfortunately, not all meniscus tears are amenable to repair. Like any other structure in the body, the meniscus requires blood supply, and it needs this good blood supply to allow a repair to properly heal. The blood supply to the meniscus starts from the outside and works its way in, and so we end up with these 3 zones. The first one on the outside is called the red zone, where the blood supply is nice and rich. followed by the red-white transition zone, and then the white zone on the inside where there's minimal blood flow. A meniscus tear in this red zone has a better chance of healing with a repair, as opposed to a meniscus tear in this white zone that probably isn't going to heal very well and might need to be cut out. If we look back at the recovery times for Brandon Roy's knee surgeries, they were really short, implying that most of them were likely surgeries where they removed pieces of his meniscus. The problem is that the more meniscus you take out, the harder it is to do its job, and you end up with higher forces and stress applied to the cartilage within the knee. This increase in stress throughout the knee joint can cause the development and progression of things like osteoarthritis. One of the unknowns about Brandon Roy's meniscal injuries is where exactly the meniscus was torn, and this is something that really could make or break the health of his knee. The medial and lateral menisci are essentially anchored to the bone at the meniscal root, but the outer rest of the meniscus is sort of just free floating. Whenever the tibia and the femur are being compressed together from a person's body weight, there's force being applied through that meniscus, but the meniscus is anchored at those two locations to basically keep it from spreading and expanding outward. When that attachment sign is torn, the meniscus can't maintain its shape there whenever the load is being applied through the knee joint, and it basically just kind of expands outward and can't support that shock absorption. Surgeons are still refining optimal management of these meniscal root tears, and so certainly how it was fixed if it happened 15-20 years ago really might have been the first domino to fall in this whole sequence of his knee problems. There are certainly a lot of other factors that can lead to osteoarthritis and the progression of it, namely some genetic factors, but it seems like the common thread here is that Brandon Roy had parts of his meniscus removed, which could have led to further progression and maybe some of that development of the osteoarthritis that eventually caused him to have to retire. Roy reportedly said that he had grade 3 osteoarthritis and that grade 4 was basically the step at which you got a knee replacement. This is partially true, and what he's referring to is something called the Algren-Lawrence scale that we use as doctors to define sort of objectively on x-ray the severity of the arthritis. Now, an important point here, we always say we treat the patient, not the x-rays, and so even if somebody has grade 4 osteoarthritis on their x-ray, clinically they might not have very bad symptoms, and so we're not going to replace their knee just because the x-ray looks bad. A lot of people wonder with Brandon Roy if anything could have been done differently to help delay the inevitable and prolong his career. One of the things we don't know about his history is how many, if any, steroid injections he was receiving in his knees to help stave off some of that pain and allow him to play. My guess is quite a few, and we know that too many knee injections with steroid can actually be damaging to the cartilage and cause more long-term complications, so this is an unknown that could have played some role in the overall progression of his disease process. The other important thing here to look at is what I mentioned at the beginning of the video, specifically the role of therapy with strengthening and properly balancing the muscles throughout the body to try to minimize the load in these joints. There's some old YouTube videos here of Brandon Roy working with his personal trainer, demonstrating some of the different exercises that he would do. And the best I could find, these seem to have been put up towards the end of his career around the 2008 to 2010 timeline. And looking at these videos, it's no wonder that part of these problems persisted, because this is terrible form of performing some of these exercises. Look at his knee position, particularly the right knee when he does these lunges, and then his knees whenever he's doing these sort of jump squats. It shouldn't take a doctor to be able to look at this and see how severely his knees are caving inward. Oftentimes people see this and think it indicates a knee problem, when in reality, it often is an example of weakness in the hip muscles that are causing the knee to become unstable and increase the pressures in different areas within the knee joint. When I saw these videos, it truly makes me cringe, because while certainly the horse might have already been out of the barn with what was happening in his knees, these exercises are certainly not helping because they're not paying proper attention to what he actually is doing and having proper form. If this was the type of therapy and training supervision he received throughout his whole career, he probably had all kinds of issues with his knees because of weakness and poor stability within his hip muscles. Like I said in the beginning, if your trainer is walking behind you, not actually looking at the position of your knees, your hips, your lower body while you're doing this, you got to find a new trainer, because this really shouldn't be acceptable for somebody, particularly at the level of Brandon Roy, and something that we even know to look out for in our younger athletes. If we look back on Brandon Roy's career, the one thing that probably would have made the biggest difference is trying to save as much meniscus as possible throughout all these different surgeries that he had. A lot of times you're stuck in a hard spot because the player could be having a lot of pain that we think is from a torn meniscus, and sometimes there's nothing to do but remove that piece of damaged meniscus, which leads to this cumulative process of removing more meniscus, till eventually, like the report said, there's nothing left and you have no shock distribution and load distribution throughout the knees. It certainly is possible that more proper rehab, particularly focusing on his hip strength and his stability, could have helped stave some of this off, but there were also likely a lot of underlying genetic factors and other risk factors that really couldn't have been controlled, and Brandon just had some bad luck. Another benefit we could have had with more modern techniques are the use of biologic therapies like platelet-rich plasma or things like what Kobe Bryant would get injected in his knee over in Germany. There's reports that Brandon Roy had an injection like this before coming back for a handful of games with the Timberwolves, but we know even more today about the optimal use of things like PRP and stem cell type injections in the knee that could have potentially resulted in some improved healing for those meniscus tears and allowed them to avoid surgery and having to cut out those pieces of damaged meniscus. That's it for the video though, everybody. Thank you as always for watching. Let me know any questions or comments below. And until next time, we'll see you later. Bye.